Thank you for letting us share your video. Myrna, we've seen her many, many years back, and she's back. If we're lucky, aging keeps coming for us, so we're going to be doing the Sculptra around the eyes, some Bello Fill to strengthen the jawline. We'll be doing a little lip plumping around the mouth, and then the Botox Dysport Xeomin on the top. Alex got started while I'm doing the modified dental block. I'm going to lift your lip here. So for the physicians and students that are watching, this is how I like to numb around the lips. It's the simplest way. It's comfortable. Do you feel a small, medium, big pinch there, Myrna? So little pinching, and you really need to make sure the patient's comfortable because you get a better result that way. If they're moving around in the chair, you're not going to get your best result. I'll give this to you. Okay, so liquid face lifting. I'm also going to go through our ABCs of plastic surgery to make sure you are getting your best results. When you know the ABCs of plastic surgery, you will make your best decisions. You're going to save money. You're going to get your best results. Can you turn the music off and then show them her before pictures? You're going to feel buzz and then pinch. 1, 2, 3. Pinch. Myrna is our A+ student looking for extra credit. She looks good. We're going to be refreshing. Little pinch. Patients today, they don't want to wait for advanced aging changes. They want to be ahead. You'll feel buzz and then pinch. 1, 2, 3. Pinch. And 1, 2, 3. Pinch. You feel small, medium, big pinch there? Okay, good. Very good. So, Myrna, what was it that inspired you to do a cosmetic treatment?
Well, like everyone else, I want to look younger.
You want to look younger. There you go.
Yeah, I really want to look like I did, 20 years ago, but that's probably not going to happen.
Well,
But
we'll get as far as we
get
can.
realistic, yeah.
And now I waited, of course, after I numbed your lips first. Then I asked you the
Yeah,
question.
of
So
course.
I should have asked you first. I know that's bad form. You feel buzz and then pinch. 1, 2, 3. Pinch. Okay, everything's looking good. 1, 2, 3. Pinch. 1, 2, 3. Pinch. Some of you are wondering, I know some of you have been watching our videos for years. We always ask our patients first. 1, 2, 3. Pinch. And if patient wants to keep their treatment private, well, then we absolutely will honor that. 1, 2, 3. Pinch. And we get a lot of patients that reach out to us and say, thank you so much. That was so helpful that I could see the treatment and they feel comfortable. Because it's confusing and overwhelming. If you go to Google and ask, what should I do for filler and all this, it's very, very confusing. So this makes it a lot simpler for people to understand. So the first thing I'm going to do, this is Bellatero Fine Line Filler. I'm going to plump these little fine lines, and if you get really close, you can see how they just kind of disappear before our eyes. Do you feel a little pinch there?
That's very low.
So she might feel a little tiny, but there's numbing medicine here as well, so that'll ease up. And we are thickening the skin. So there's two main ways you're going to inject the filler. You can thicken the skin like what I'm doing here. In corner of the mouth, you feel pinch. 1, 2, 3. Pinch. You can thicken the skin. You can inject deep to the skin to reinflate, or you can do both. 1, 2, 3. Pinch. Everything's looking good. Go nice and slow. We're not in a hurry. When you're injecting superficially, the risk that you put the filler into a blood vessel is pretty low. That's why you want an expert injector or superficial injection technique, or you use that safety cannula, which we will use later in the video. But for the fine lines, then I got to use a fine needle to really address what we're trying to achieve. Can you purse your lips like you're going to whistle for me? And you see when she does that, I see the pucker lines there. Now relax as best you can. Everything's looking good. Thank you for watching. Thank you for sharing. So, what are the ABCs of plastic surgery? What do you need to know to get your best results? A stands for area. The 4 areas we address to look better. If we sag, we tighten. If we lose volume, we fill. That's what we're doing right now. Sun damage, wrinkles, and sunspots to the skin. We can polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift. And Myrna, she's got a great smile. She knows the power of smile. And I tell patients, if you really want to look your best, it's about the smiling, but I will help them to look younger. And if you want to look even younger than what we can achieve with the fillers and the treatments, you just have to act immature. So, A is for area. B of the ABCs of plastic surgery is the boundaries. What are the rules for good plastic surgery? Safety's always first. You must look natural. Let's prevent future age changes and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, it's better than going too far. So A for area, B for boundaries. C stands for combination. If you want your best result, we combine treatments. We combine tightening, volume, and skin. Now, if you want your best results, but you just want 1 minute, then usually it's lifting and tightening. And if you want your best result, but you don't want any downtime, then it's fillers like we're doing today. Now, fillers do a great job. You feel a little pinch here, but they don't give us a facelift, right? You can do a liquid facelift, but you still get a better result when you're going to do the actual lifting where you're tightening the muscle. So fillers do a great job. They don't give us a lift. You feel a little pinch here? Lifting gets wonderful results, but I can do better when I combine. So if you understand combination treatment, whatever treatment you choose, if you're happy with your results, great. And if you want more results than what you've achieved, you can always take the next step. You feel a little pinch there, Myrna? Okay, good. There's numbing medicine inside the syringe that I'm injecting, so every time I inject, she's going to feel less and less, and she feels very little right now, if nothing. Very good. There's no restrictions afterwards. I like my patients to do a 5-minute massage 5 times a day for 5 days. Patients tell me they appreciate that. They see just a little here, a little there. You're going to stay out of trouble that way. You're not going to go too far. And I'm going to do some little extra massage here. Very good. So I did the vermilion border on the top and bottom. Let me set this over here. Can I change my gloves, please? Thank you. And I'm going to do the vermilion border on the other side as well. And thank you, Alex, for being our camera person. We're very proud of our live videos, no filters, no editing. Just what you see is what you get. We're on a mission to stop bad plastic surgery. We're here to help you raise your standard so you can achieve your best results safely. Okay, now a little bit in the vermilion border here. Very good. Now, as I tell patients, you don't want to taste the chocolate cake before it's done baking, but I want to show you, Myrna. Why don't you take a look in the mirror? Can you see how we've got a little plump across the border of the lips? How does it look so far?
Looks great.
Good. Do you want a little more plump in the body of the lip, or do you want to leave them about the size where they are?
You mean here?
Well, in the body of the lip, like it'll be a little bit of pout and just a little tiny bit of a pout, but not too much, or leave it alone. What do you think? I can add a little more and it'd be okay.
Okay, that's fine.
I'm just going to very slowly.
Okay. Mm-hmm.
Very good. And it's good to check with the patient halfway through so that they can see and that they understand what's going on. And this way they feel, okay, they're in control, which they are. You're going to feel a little pinch here, 1, 2, 3, pinch. I like to pay attention to the corner of the mouth because that's where we get that downturn of the mouth. And it's the worst thing ever. People talk about, they say resting bitchy face. That's just the worst. That term should not exist, but it's made it into our vernacular. And of course the cure for that is the smile. But we can also do some filler in the corner of the mouth and help that out. Patients will tell me, they say, well, people tell me, am I angry? Am I upset? Or Are you tired? And so these are the solutions to look less tired, to invest in yourself. And what's really awesome is that, a lot of our patients, whether they've raised a family or they're always doing things for other people, now is our chance to give to the giver. And we can't pour from an empty cup. We need to give to ourselves. And you find out there's actually more to give. We're all guilty of that at some point, being very selfless and just for others, always putting ourselves last. So it's an honor that we can be a part of this for Myrna. She's got many active years ahead of her, and she's going to love her results. My patient last week was telling me how she did not expect how good it was going to make her feel when she saw her results. So that's the key. When we look good, it makes us feel good. We want to do good. Appearances do matter, and we can use them to our advantage. And Ari has everything set up perfectly, makes it very easy. Thank you, Ari. But you can see her lips are not overpowering. Nobody wants the lips to enter the room before they do, right? So we'll keep it under control. We won't go too far, just little bits here and there. That's all we need to get the job done. How are you feeling, Myrna?
Right.
She's tough. But you don't have to be tough. We make it easy. For patients that tell us they hate needles, they're allergic to pain, we do a great job. It's very rare that patients need Valium. I mean, I can give Valium, but then you need a driver. We also have laughing gas, but it's usually not necessary because, they're just comfortable with the numbing medicine. Okay, very good. I'm going to do a little bit in the smile lines through here as well. And a little bit of the numbing medicine. You feel buzz and then pinch. 1, 2, 3, pinch. Sorry, a little pinching. Very good. 1, 2, 3, pinch. We get that nasolabial folder, just put a little volume through there, just enough, but not too much. Pinch. We'll give patients ice after their treatment, and it's not mandatory. You can ice until the ice gets warm, or some patients want to ice longer. Sometimes ice can increase the swelling. There's usually not much discomfort afterwards. You might feel a little sore or achy, but then that is short-lived. And if you take Motrin or NSAIDs or ibuprofen, it can thin the blood, so you don't want to, a little pinch here, 1, 2, 3, pinch. You don't want to increase risk for bruising with the anti-inflammatories. Because you can take Tylenol. Tylenol is usually enough, if anything at all. When I did my fillers last week, 1, 2, 3, pinch, I didn't take anything at all. And you can see that video, posted the time lapse on Facebook, and even the before and afters, the one day after. So I'm going to come back and do more of the fine line filler. So we're going to do a little bit in the brow and a little bit in the cheek. You feel a little pinch there, not too bad? Very good. We are an essential service. People want to look and feel their best. And in today's world, with all things going on, I mean, it takes a toll when we're locked down and isolated. So people are coming in to reinvest in themselves. So I'm going to build a little bit in the cheek, and mostly really anterior to the inferior orbital rim. Pressure pinch with twist technique. Shiver technique, so I put a very fine amount of filler over a large area. I was looking back, we have a video out there. We were doing this over 3 years ago, the twist and shiver technique, and very proud of what we've been able to share with other doctors. Little pressure pinch, pressure pinch, pressure pinch. And there's some numbing medicine. You'll feel a little bit numb and goofy under the eyes. How are you feeling, Myrna?
I feel good. I'm afraid it was really going to be bad.
You're not ready? Say that again?
I was afraid it was going to be bad, but it's
How
not.
is it? Oh, good.
It's great.
Well, I'm very proud of you for choosing such a great doctor.
I am too.
You get the hang of it after 20,000. I've done over 20,000 syringe injections of filler.
Wow.
It's true artistry. And most of the people that are doing facial fillers, most of them are beginners. Because they just don't commit to it. They don't use the permanent fillers, they use advanced fillers, they don't use advanced technique. They don't have the experience. No substitute for experience. No substitute for results. And we're very proud to be global leaders in live video education for facelift and filler treatments, all under local anesthesia. Everything's looking good. I'm going to do a little bit in the brow because we talked about the eyelid treatments. You want to think in the brows and around the eyes. We know we are going to hollow as we get older. So let's just reinflate. You can get a very nice brow lift that way, non-surgical. In the 80s and 90s and even early 2000, people got a little overzealous with all the brow lifting and pressure pinch. It can give that surprise look. Pressure pinch, little pinching there. Myrna has a little scar tissue from a previous treatment. Pressure pinch. So I'll just go delicately there, a little bit of numbing medicine. Sorry, pinching. Okay, there we go. Little numbing. Pressure pinch. That was a little more tender. Perfect. Very good. So a little massage immediately afterwards. You doing okay, Myrna?
Mm-hmm.
Very good.
I'm good.
Pressure pinch, pressure pinch. This is subcutaneous pressure pinch, pressure pinch. Right anterior to the superior orbital rim. Very safe place to inject when you know the anatomy. A little bit more here in the cheek. Perfect. Okay, so a little tiny bit more here in the cheek. And I like to reference back to the pictures. Pressure pinch. You're going to feel my finger here. Because I'm looking at the anatomy, I'm constantly scanning her face to see where are the shadows, where is the contour, where is the balance, where are the underlying structures. You feel a little pinch there that they erode away over time. That's very natural, that's very normal. And we're going to build a little bit laterally in the cheek as well. Very good. You doing okay? If you feel lightheaded or anything like that, I can lay you back in the chair. That's uncommon, we need to do that, but every now and then a patient may have what's called a vasovagal reaction. You might feel lightheaded. If they're dehydrated, the fluid, the blood flow pools in the legs or the lower body, and then it's away from the brain, so then the brain feels lightheaded. And then sometimes if you let it go for long enough, you can even pass out. But if you catch it early, you just lay them back and it goes away instantly. can make you feel upset stomach or tingly or see spots. That's why you need to be tuned into that and nip it in the bud.
Dr. Rich, Kelly says hi. What procedure is this?
Hi Kelly, we're doing liquid facelift. We're using the Sculptra, Bellafill, Bellatero. You doing all right?
Mm-hmm.
And we're going to use some of the Botox Dysport Xeomin lateral cheek. So I'm going to do half of the syringe on this side, half on the other. A little pressure pinch. There's some numbing medicine. We're just going slowly and gradually. Pressure pinch, pressure pinch. You doing okay, Myrna?
Yeah, I'm doing great. Thank you.
Very good. Everything's looking good. I'm very happy. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're based out of Tampa and the Villages, Florida. We're doing liquid facelifting. You can download our book on Amazon. We guarantee we can make you look younger. If you have questions, give our team a call and they can set up a consultation. Send us your pictures. We're happy to give you a plan on what's right for you. You have a hemostat? That's fine. I'll just use this. It's fine.
You got it?
I'll use this one. It's fine. Okay, a little bit more Sculptra in the cheek. Pardon. Just to define the zygomatic arch. Pressure pinch, little pinching here. Lateral cheek. Pressure pinch, pressure pinch. Now I'm going to define some with the jawline here. Let me turn your head this way just a little bit. That's good. So as we age, we lose skin, muscle, fat. We also lose bone. Let me turn your head just a little bit more this way. And as we lose bone, we can get a little shorter. Well, we also lose bone in the, we also lose volume in the face and skull. And as the skull bone gets a little shorter, the skull gets smaller, the facial mask will sag over top and it kind of catches around the smile lines. So we're just reinflating. You want to think about inflation and deflation in the face. So when we reinflate the facial structures, you turn your head this way, it makes us look as we did when we're younger. Just look at your photos in high school or your yearbook pictures or college, or you just use a little 27 gauge. Any pictures from 5, 10, 15, 20 years ago, you will likely see some change in the volume. Everything's looking good. So pressure pinch, twist, twist, twist. How are you feeling, Myrna?
Good.
Are you feeling much pain?
Not a lot, no.
Little pinches, big pinches?
Medium.
Medium right there, okay. And the more I inject, she's going to feel more numb. How about now? Are you feeling any pain at all?
No.
Very good. Perfect. Let me turn your head this way just a little bit. So again, we're strengthening the jawline. I did half a syringe before, and turn just a little bit more. Now, do you feel anything here or not really?
No.
Now that I've already injected and there's some numbing medicine, she'll feel very little. So that's to our advantage, and that's by design. I do those little bits of injections just to start out the process and also to get the best anesthesia. And I'm going to massage that area. We're just putting back what was already there.
Dr. Rich, Maria is asking about the pricing for this procedure.
So for the pricing, you can give us a call, 813-463-9245, and we customize the pricing based on what you're looking for, because everybody does not do the same thing. You can go to our website, imagelift.com/pricing, and you can put a wish list together, and then it'll give you the price of what you're putting. But you really need a consult to get your best price, because you don't want to overdo what you may not need all those things. Or if you do a consult and you say, oh, well, if you're looking for XYZ result, then we need to do more, we need to do less. So that really depends on what you're looking for. So now, one more time, I want you to look straight ahead for me.
Oh,
So can you
wow.
see how it defines the jawline and a little in the cheeks? Now, I'm not done yet. I'm going to do a little in through here. I like the projection of her chin. I'll do a little touch in this area. How's it look so far?
It looks good. Is
And I'm going to
there
put a little touch more in there as well.
some in here?
Absolutely. Both sides I'm going to put a little more. And remember, you don't want to taste the chocolate cake before it's done baking. Even if I don't, and I'm going to do a little massage through there, an injection. Even if I don't inject
Looks
anything,
good.
I just pass the cannulas.
Looks really good
Yep.
so far.
You'll get swelling from what we, just passing the cannula. So we need to, back that out of the equation. But I really like what I see, and we're on track. There we go. Can you turn your head this way just a little bit? Very good. Pressure pinch, pressure pinch. Same on the other side. These are all the common areas that we lose volume. You turn your head this way. Pressure pinch. Still pinching there, sorry. I'm going to do a little bit more definition in the jawline as well. Right on track. Feel a little bit of a pinch there, not too bad. So this is fanning technique, small amounts of filler over a large area. Hyaluronic acid is a great fine line filler. They are also reversible, although it's rare that you need to reverse it. Perfect. Very good. I consistently will put similar volume amounts on both sides, and that is to make sure, obviously, that you maintain the symmetry, but none of us are 100% symmetrical. You can look at my pictures on Facebook. I put the before and afters, and you can see I have facial asymmetry as well. And I confess, when I see that, when I have a flat facial expression, I don't like to look at my own facial asymmetries, right? It doesn't make me feel good. So I can imagine if I just stare at that and say, geez, I wish that were better or gone, that would make me feel bad. But when I put a smile on my face, Like, it's such a difference. So I don't like to look at myself unless I'm smiling. That's why I just look the best. So, but I do like to look younger, and I want to my aging changes. So that's why I like to do my fillers too. Because we can't let Myrna be the only one to have all the fun. I mean, we want to have some fun too. I'm going to turn your head this way just a little bit. Everything's looking good. Perfect. And I love seeing that jawline get defined. It actually will help to minimize or eliminate a jowl just by filling in that volume loss. Loss of volume in the jawline will create a jowl. And nobody wants to create a jowl. Let's turn your head this way. Nobody was talking with their friends and says, guess what we're making today? We're making jowls. They're like, no, I'm not coming to that party. Pressure pinch, pressure pinch. Everything's looking good. 2021 is here. And I got a lot more suits to wear. It was so busy I didn't wear my suit today, but we're going to be wearing more suits, so just be ready for that. We like to have fun. My wife and kids, they're so embarrassed. That's one of my other superpowers, is my ability to embarrass my wife and kids. Like, I can do it so fast, and I don't even have to think about it. It just happens. It's natural. I'm very good at it. Now, when I do the Botox Dysport Zoom in, I want you to frown down real hard for me. Now, raise your eyebrows up real high. Now, relax as best you can. So you feel buzz, and then pinch on 3. 1, 2, 3, pinch. So I use about 15 units in the glabella. 1, 2, 3, pinch. I like to give people 2 weeks, 1, 2, 3, pinch, to get the full effect. If you try and get a touch-up before 2 weeks, you're going to be wasting your time, because you got to let the Botox have its full action, its full effect. So, if at 2 weeks, if you think you need another unit, then you can always add more. When we do the brow, pinch, that gives a little elevation to the brow, which people like. Women like it. You don't want to elevate male brow too much because it feminizes the brow, and most men don't want that. So that's important to be aware of when you're doing the Botox Dysport Zoom in, is what will feminize the brow. Botox Dysport Zoom in down here will improve the crow's feet. 1, 2, 3, pinch. Sorry, pinching. Pinch. Pinch. And then across the forehead, I like to put light dosing, but not zero dosing. Put a little dosing here, because you don't want that severely arched brow. That's what everybody wants to avoid. They don't want to look that way. We're not going to let that happen. We're treating here, and we'll soften a little bit. If you get the arched brow, come into our office, because we can treat that. You know, that happens in some offices or locations, but not here, because we're going to pre-treat it. Now, I like to do a little centrally, and then I will put a very fine amount over the medial aspect of the brow, over the pupil, just half a unit laterally, not too much, just half a unit. Let me turn your head this way a little bit. Same thing here, over the medial aspect of the brow. Can you blot on that spot for me? Hold pressure there, real firm. And then I'm going to do another little half bit right here. Good. And we hold pressure, and then bleeding subsides very quickly. Very good. Another little half unit here. Good.
Dr. Rich, Lily says hi.
Release. Hi, Lily. Thanks for watching. Thanks for sharing. Please share with a friend, because we know you have someone. First of all, they're going to be upset if you tell them you saw live cosmetic treatment and you didn't share it with them. Secondly, if you have a family member or friend that are thinking about a cosmetic treatment, You're going to save them time, save them money, and help them do it the right way. We're on a mission to stop bad plastic surgery. And we are going to raise your standards by helping you do things the right way. So, why don't you take a look here? So, I'm going to do a little massage, but you can see through here. How does it look so far? Are you happy with what you see?
Oh, yeah.
Make a big smile, it's natural, but you're still a little swollen, so you're not 100% ready for your close-up.
No.
The swelling's going to settle. The collagen's going to build.
Right.
The lips are going to absorb a little bit of water, so I want to see you at 6 to 8 weeks. But if you need me before then, you come at any time.
Okay.
5-minute massage. 5 times a day for 5 days. In the cheeks, in the brow,
Oh, wow.
the back of the jawline, and around the mouth. Are you happy with what you see?
Yes, I am.
Very good.
Very much so.
Congratulations. Now here is our before, so she still looks like Myrna, right? She's not overdone. And we just soft strengthen. Look at this. Let me turn your head this way to the side. Look at the strength of her jawline here compared to before. It was almost fading away. Now she's got good definition, but she still looks like herself. So thank you everyone for watching. Congratulations. I give you hugs. Hugs to you guys too. We're on a mission to stop bad plastic surgery. We're here to do things the right way. Happy New Year. Let's get those vaccinations, and we'll see you in the next video.
We have one question.
Oh, question, yes.
For Maria, are you open on Saturdays?
My team, not right now, but if you work something out with my team, then you're a good negotiator if you get them here on Saturday. See you later. Congratulations.
You look beautiful.
Thank you.